Hi, I'm Dr. Caleb Slater, and today we're going to talk about piriformis syndrome. Most of the time, you don't have piriformis syndrome. Most of the time, stretching your piriformis muscle isn't the answer and will likely make it worse. We all think that stretching is what muscles need to do. Yes and no. Muscles actually like to contract more than anything else. They like to contract, they like to shorten, they like to move you. That's what they were made to do. And when they contract, they actually get blood flow in and out of them, which actually helps keep the muscle healthy, helps the muscle heal, helps promote good blood flow to the area. Most of the time when you're stretching, you're actually pulling the muscle too far apart and you're not promoting blood flow. Piriformis syndrome is an entrapment of the sciatic nerve and or blood supply at the piriformis muscle. The piriformis muscle is located in the body, in the glute region. It is a deep muscle that's an external rotator. Why is the piriformis muscle well known? It's well known because it's commonly pierced by the sciatic nerve or blood supply. In about 20% of the population, that's the case. In the other 80% of the population, the nerve or blood supply runs underneath the piriformis muscle, so when it spasms or gets tight, it could theoretically put enough pressure on the nerve to cause sciatica, to cause an irritation to the sciatic nerve, which would cause symptoms of numbness, tingling, and pain down your leg, likely down the back of your leg, into your calf, or into the bottom of your foot. Here's the problem though. Most of the time, it's not piriformis syndrome. Why? Because the nerve isn't actually irritated at that level. It could be, but it's more likely irritated up closer to the spine. The sciatic nerve emerges from the lower lumbar spine and the upper sacral spine. So we'll point to that region. This is the area that the sciatic nerve emerges from. It travels down, goes down, pierces or runs underneath the piriformis and runs all the way down your leg to innervate your muscles, tendons, skin. Most of the time, the nerve is more irritated up here rather than down here, but down here is where you're noticing the symptoms. You need to think of your nerves like a hose, okay? Stick with me. The hose has good water flow through it. If there's enough water flow, a little bit of kink at the hose isn't going to really change much. But if the water flow closer to where the spigot is diminished, then a little bit of a kink further down the line will cause enough of a flow issue that you'll have trouble doing whatever you're going to do. That's kind of the way our spine works. That's the way our nerves work. The sciatic nerve travels down, and if the flow is good, a little bit of compression here isn't going to do anything. But if the flow is diminished, if the nerve conduction velocity is diminished, and that signal isn't as strong, that signal can't get down as quickly or as good as it should, then extra compression at this area will cause a problem. Most of the time, stretching the piriformis is what we tell patients to do, or what the current medical system tells patients to do. Here's the problem. When you stretch the piriformis muscle, you actually compress the sciatic nerve. It's temporarily, and hopefully the idea behind it is that you stretch it enough so that way when you stop stretching it, there's less constant pressure on the nerve. But what you're also doing is tensioning the sciatic nerve during the stretch. Most of the positions that we tell people to do, the pigeon pose, other piriformis stretches, actually tension the nerve. Nerves hate to be stretched. Nerves don't have a lot of elasticity in them, and if you stretch a nerve too much, you're actually just going to piss it off. Often it'll feel a little bit better in the moment, but it'll hurt worse later on, and you'll keep doing it, keep doing it, keep doing it, and it'll just get worse and worse. You're much better off first looking up the hose, closer to the spigot, closer to where the nerve is actually coming from, closer to where the information is being sent from, and seeing if there's a problem in that area first. The problem in that area would mainly be in the L4, L5, and S1 region. And there's a few easy treatments that we do for these patients. I'm going to have my lovely assistant here, Danielle, lie down on her stomach. And one of the first things that you need to do if you're going to try treating this is you need to map out your symptoms. Ideally, you can find something right then and there that causes the pain that you're coming in for. So if you have pain right here, if it's during squatting, if it's when you're going up and down stairs, if it's when you cross your legs, great. You want to map that out first. Where it happens, how quickly it happens, and how much it happens. Throw a number on it. 5, 6, 7 out of 10 pain. Think about it, because then after you're treating yourself, then you want to see if it's changed. Okay? The L4, L5, S1 region, right here, And often what we do as clinicians is we put some pressure on the areas we start above. Most of the time, if the joint is healthy, if the spine is healthy, the only thing the patient feels is pressure. That's a healthy joint, that's a healthy spine. When you get closer to the area that's involved, you'd be surprised on how little force actually elicits the symptoms of pain. If that's the case, we look to mobilize those regions for you. I can apply more focal force, more often, more repetitions than you can just doing an exercise. But afterwards, we show you an exercise that's going to accomplish the same thing. All right? So first, I would look and confirm that it's the L4, L5, S1 area, and I would mobilize those areas. Then I would show you how to help treat yourself. One of the best treatments for this area is a press up, okay? But there's a few ways that you can mess it up, so let's troubleshoot it. We're gonna ask the patient to put her hands right by her chest. Now, what people do wrong is that they try to use all of their muscles of their body to accomplish this. For lack of a better term, this area and down should be dead. There should be no muscle contraction, because what happens is that you'll get your paraspinals, you'll get some of your back muscles, some of your butt muscles, and you'll actually tension the spine, put compression on it, or limit it from moving. You don't want that. So what you need to first do is make sure everything's relaxed. In order to help the glutes relax a little bit, we tell patients to turn their feet inward to help take a little bit of tension off the glutes, help make sure that they don't contract. So now what I want you to do is I want you to press yourself up about as high as you can. Good, and then nice and slow back down. The other thing that people don't do is they don't give this enough time to work. So I'm gonna ask Danielle to do 2 sets of 10. Go ahead, Danielle. She's gonna do 10, making sure I'm touching her muscles, making sure that she's not contracting them, making sure that she's not using her glutes, making sure that she's giving herself enough time and going through enough range. She's gonna do 10 and then she's gonna rest. And then she's gonna do 10 more. After that, now we wanna test out your symptoms again. Whatever was bothering you before. If it was a squat at a certain range, going up and down stairs, whatever it was, hopefully you're able to find something. Now we wanna test it out again. Hopefully it's changed. If not, here's the other thing that people do wrong. They give up. 20 of these might not be enough to cause the change at these large vertebrae, these large joints that literally take up the majority of your body weight and the majority of your tension that you're putting throughout your day when you're sitting, running, standing, anything. You might need to do more. So then we'd ask the patient to do another set, 2 sets of 10. We'd likely do a few more mobilizations, and then we would try again. Most of the time, this is going to help take pressure off that area and help turn that faucet on to full, so that way that nerve can now get a full signal down, and that way that little compression at that area of the piriformis no longer matters.